We will start the lecture on general anesthetics. In the morning, I have completed the inhalational or gaseous anesthetic agents. First, you should know what is the anesthesia and what are the anesthetic agents. The level of loss of consciousness, CNS depression that allow the surgical operation, that is called the anesthesia. There are different types of drugs which are used for the anesthesia. There are two main classifications: the inhalational anesthetics or the intravenous anesthetics. Inhalational anesthetics, they are found in two forms: volatile liquids and the gases. Volatile liquids produce their effects, and their effect is depend upon the solubility, blood gas partition coefficient, or Oswald coefficient. There are several anesthetic agents which are used through the respiratory route of administration, either volatile or in the gaseous form. Now I will start the MAC value. MAC means minimum alveolar concentration, and this is the relationship between the dose of the drug and quantity effect produced by the drug. Means the dose you have given to the patient and the response of the patient to that particular agent. It is called minimum alveolar concentration or the MAC. MAC of anesthetic agent is results in the immobility of the patients when they are exposed to the noxious stimulus such as surgical incision. MAC is used to measure the potency of all inhalational anesthetics. Means you can calculate the potency of the inhalational anesthetic agent by the calculation of MAC. MAC value decreases in the elder patients, but it does not affected by the sex, height, and the weight. MAC value decreases when you have given opioid analgesics, sedatives, and the hypnotics. Now, the intravenous anesthetics. The first and the most important intravenous anesthetic is the barbiturates. Barbiturates also used as sedative and hypnotics, but the ultra-short barbiturates like thiopental sodium and methoxytil, they are used as intravenous general anesthetics. Then the other group, which is known as the opioid. Opioids are used for the central analgesics, but fentanyl and morphine, these are two opioids which are also used as intravenous anesthetics agent. Then the ketamine. Ketamine belongs to the general anesthetic, which is known as dissociative anesthesia. Means patients is dissociate from the surrounding but still awake. Then the propofol. This is also including under the classification of intravenous anesthetics, etomidate, and the group benzodiazepine. Benzodiazepine also hypnotic and sedative, but they are also used as intravenous anesthetic agents like lorazepam, midazolam, and diazepam. lorazepam, midazolam, and the diazepam. These three benzodiazepines, they have the ability to produce intravenous anesthesia. Merits of the thiopentol. The thiopentol is potent barbiturates anesthetic agents, and it have the ability of rapid induction and the recovery. That is, the duration is very short between the induction and the recovery. Rapidly cross blood-brain barrier, rapidly diffuse out of the brain and redistribute at the muscles, fat, and all the body tissue. The barbiturates used to induce the anesthesia, or either it is used to maintain the anesthesia by the ether, does not inhibit uterine contraction, used to control convulsions also, because it is also anticonvulsive agent, not respiratory irritant, and there is no hepatotoxicity. So these are the merits of the thiopentol. The demerits of the thiopentol, intravenous anesthetic agent, that is the respiratory center is depressed. So patient may experience a brief period of the apnea. It have no analgesic properties. It may be able to cause cardiac depression, hypertension, and the muscle relaxation property is also lacking in the thiopentol sodium. Sometimes patients may experience bronchospasm and the laryngospasm, and allergic reactions can be observed in the patients who are receiving the intravenous anesthetic agents. If given intraarterial, they may produce or they may cause the formation of the thrombus, or may be able to cause the gangrene of the limb. These thiopentol sodium, they are contraindicated in porphyria and respiratory diseases because it can cause bronchospasm or the laryngospasm, or may cause cardiac depression. So they are prohibited in the patients who are under shock. So these are some intravenous anesthetic thiopentol sodium's demerit. Then the intravenous anesthetic agents, ketamine, As I have told you, ketamine is also known as dissociative anesthetic agent. It is short acting and it is not belongs to the family of barbiturates. It causes the dissociative anesthesia in which patients remain awake. They can listen, they can feel, but drowsy and immobile. But the pain sensation in these patients are less. They can listen everyone, but they dissociate from the atmosphere. The ketamine have powerful analgesic properties, so it is used in the procedures of burns and short procedures in the children. So it is used in children and adult for the short procedures like dressing of the burns. Highly lipophilic drug. Lipophilicity causes rapid distribution in the brain, subsequently distributed into the high vascular arteries. So these are the merits of the ketamine, and ketamine is an intravenous general anesthetic agent. Demerits of ketamine: it causes post-operative hallucinations, means patient may experience something abnormal that are not normal, but they are not present, but they can feel post-operative hallucinations. Increased cerebral blood flow, so the oxygen consumption along with the pressure of the brain, they both are increased. So the ketamine is not an intravenous anesthetic agent which is preferable for the neurosurgical procedures. Heart rate, arterial blood, and the cardiac output are increased for 2 to 2 minutes and then decline to the normal. Means if you are giving the ketamine to the patient for the surgical procedure, patient may experience increase in the heart rate and the increase in blood pressure, and cardiac output are increased also. The ketamine decreases the respiratory rate slightly for 2 to 3 minutes. These are some demerits of the ketamine. Intravenous anesthetic agents, benzodiazepines. Diazepam, lorazepam, and midazolam. They have slower onset, means their induction is slow and the recovery period is prolonged. So the first and the most important merit of a good anesthetic agent that they causes the fast induction and fast recovery when benzodiazepine backing in these things. This is used as anesthesia and is also used as pre-anesthetic medications, intraoperative sedation, and with other drugs as part of balanced anesthesia. Means the indication of benzodiazepine is as anesthetic agent, as pre-medication, intraoperative sedation, and they are also given with the other drugs as a part of balanced anesthesia. Opioid analgesics, anesthetics, they are morphine and the fentanyl. The demerit is large doses required to achieve general anesthesia. Fentanyl is used as pre-medication also to reduce the pain during the procedure or after the procedure. They provide profound post-operative analgesia because they are central analgesic agents. Opioids can increase chest wall rigidity, which impair the ventilation, and post-operative may be respiratory depression. If patient experienced post-operative respiratory depression, the naloxone is a drug which is given to antagonize the opioid anesthetic agents. The propofol. Propofol is also used as intravenous anesthetic agent. It is important intravenous anesthetics The propofol have the ability for rapid induction, rapid recovery, which was lacking in benzodiazepines. So when you compare the agents, so this is the advantage of the propofol, and delayed induction and delayed recovery, the disadvantage of the benzodiazepine. Patients feels better post-operatively, means post-operatively with other agents, patient experience the vomiting. In the case of propofol, the post-operative vomiting is uncommon. So it was also termed as intravenous anesthetic agents, which has anti-emetic property. Someone asked that which one the intravenous anesthetic agent has anti-emetic property. The propofol is the agent which have the anti-emetic property. It also causes decrease in the systemic blood pressure. This is all about the anesthetic agents. There are two types of anesthetic agents. One is the intravenous anesthetic agents and other is the inhalational anesthetic agents. There are two main definitions like blood gas coefficient and the MAC, mean minimum alveolar concentration. So you should know, in cases of inhaled anesthetic agents, there is the blood gas coefficient or Oswald coefficient. That is the presence of the inhaled agents